Welcome, everybody. It's Georgia Reed from Cybercrime magazine, and today we are filming a podcast video interview with Kathy Hughes, VP and Chief Information Security Officer at Northwell Health. Welcome, Kathy.
Thank you. Well, I'm glad to be here.
We are very happy to have you. You're our third guest on our Ask the CISO series, which is brought to us by Fortinet. And wow, I mean, Northwell Health is one of the biggest, if not the biggest, employer in New York State. Is that correct?
Yes, it is.
So, founded in 1997, and then it's a nonprofit healthcare network with $12 billion in revenue, 23 hospitals, 700 outpatient facilities, and 67,000 employees.
Very large organization, and it's growing daily.
That's amazing. Just wanted to get some background information about yourself as a woman in cyber, heading up the biggest employer in our state of New York. What's your background and how did you get to be in this role?
So most of my career was spent in infrastructure, technology managing, server teams, network teams, data centers, help desk, desktop services, and security was always part of each of those areas that I managed. Over time, opportunities became available where I took on more focused roles in disaster recovery. And while doing that, I was at Northwell, I was asked to take over the security team because the director of the group had resigned. And I really got to learn a lot about some of the challenges that were facing not only healthcare, but the world when it came to security, and how it was really becoming an area where a lot of focus was needed. So I took a real interest in it and really tried to champion for more investments in it and staff. And during that time, I actually became the victim of identity theft.
Really?
Yes, and it really became very personal for me. I realized, firsthand what it felt like to have your identity used for fraudulent purposes. It was felt very violated. Sure. And was a very eye-opening process to go through to make sure that I could reestablish my credibility and get my feet back on the ground. And it became very, very personal for me. And when the opportunity became available for a Chief Information Security Officer, I really, was something that I pursued and have been doing now for the past 3 years.
You felt a call to really serve
I really
in that
did.
regard. Well, I don't blame you. What did they get your information through personal?
It didn't.
Emails,
the actual source was never really determined,
Okay.
But I had gotten some bills for cell phones that were taken out in my name that I had never taken out, and some fraudulent charges, several $1,000s worth of fraudulent cell phone charges.
Well, with healthcare, I mean, there's so much patient data now that's could be vulnerable if it's not secured properly. So what are the key security challenges facing healthcare today?
Yeah, so there's some of the challenges are really the same in any industry, but in healthcare, because we've connected data and systems at such a rapid pace over the last few years, there's been little thought put into security, more thought put into how do we connect quickly.
Gotcha. So that left some vulnerabilities.
Absolutely. It's left some, security really is an afterthought. And that mindset is changing, which is really good. But up until this point, that has posed a lot of risks just to healthcare in general. There's also, a lot of legacy equipment, systems that are still in use, specifically medical devices where they typically are meant to last 10, 15, 20 years.
Sure.
And if you were to ask somebody in a biomed area or a clinical area what a medical device is, they would describe it probably as some type of therapeutic or diagnostic machine that provides clinical care. If you ask me that question, I'm going to tell you it's a computer with an operating system that is susceptible to all the same threats that any type of computing device is. And that poses a lot of challenges now that we're connecting all those devices to systems and data.
And it's an Internet of Things problem. Is that?
The Internet of Things is a different problem, but similar.
Okay.
The Internet of Things devices were really built with just pure functionality in mind. They have very small operating systems, and security is more of a bolt-on than a built-in to those devices as well. And there's tremendous value that they bring not only to healthcare and business in general, but just to our personal lives that people really want to take advantage of. So, and there's a lot of them. So people don't, there's between IoT devices that run home heating systems to Fitbits that people wear, and there's a lot of applicability that can be used in healthcare where people are wearing devices or using devices to monitor, health and report that to clinicians.
Interesting. So some data in the hospital is in the cloud.
Yes, I think that more and more healthcare organizations, like Northwell, are looking to move systems into the cloud. There's a lot of value to doing so, not only financial benefit, but there's also the data sharing capabilities are so much more facilitated when you have data in an area, and that can be accessible by multiple different entities for the purposes they need. And they also have a lot of focused staff on maintaining the environment and do use latest and greatest technologies typically to support those environments.
So where are the key healthcare security focus areas for 2019?
Yeah, so we are really focusing on a lot of different technologies, mostly on securing the patient at this point, where in the past we have focused on securing a data center or securing the cloud, and now it's kind of gotten to the point where we have to secure the patient. And that involves a lot of, different technologies and making sure that the people that you've entrusted with the data, namely the insiders, and insiders can be employees, consultants, business associates, anybody that you've entrusted the data to, you need to protect that, and you need to be able to detect if there's any type of anomalous activity that's taking place. So that's prompting a number of investments in technologies that can detect either intentional or non-intentional type of activity. So machine learning type technologies, artificial intelligence technologies, user behavior analytics is another area where you can determine or monitor what a particular user's typical activity is. So if you typically come to work Monday to Friday and you typically access these 3 websites and those 4 systems, if anything anomalous occurs, which would be learned over time, that would potentially set an alert that could be looked at further to see if that was just a one-off or there was really something malicious that was going on. It's very difficult to discern between what might be considered regular type of activity or normal activity someone would do versus something that might be malicious because they're so close.
But the data analysis helps you with
The
that.
data analysis and collecting of that data. First,
Right.
the collecting and the analysis of the data would help determine that.
Sounds like the insider threat is a major concern for you. How do you go about dealing with that and managing it and teaching your staff for the 67,000 employees?
Yeah, so it is a very big issue. And as I mentioned, we are looking at other technologies to supplement what we have today that can do more of the machine learning or automated detection and response activities. But currently we use data loss prevention technologies which identify or alert us to certain types of activity that take place. And if there are thresholds that are exceeded, so for example, if we see somebody who might be faxing a list of patients that exceeds 200, that might set off a flag for investigation. And then we would determine, is that normal behavior or is that something that might be malicious? There's also what's called SIM technology, which is Security Information Event Management. So all of our key systems are collecting logs, and we are analyzing those logs to determine if there's anything that's anomalous that might be taking place that requires further investigation. And that's usually done on the inside of the network as well as on the outside with any externally facing systems.
Well, you have something pretty unique. You hired a security awareness and training manager. And when did you hire her, and how did you come about that idea?
Well, training and awareness is probably, people are the weakest link in the security chain. You can have all the wonderful technologies and layers of technology, security protections in place, but ultimately it comes down to the person, right? To people really being aware of the threats and knowing how to detect them and how to report them so that, things can be done to prevent that from resulting in any type of an event or incident. So we developed a security and awareness training program where we promote very heavily a culture of awareness. And we have a manager that leads that. She has a few staff. And we have partnered very closely with our corporate communications team to identify all the communication methods that can be used to reach our workforce. That includes postings on intranet pages to screensavers. We have a very robust phishing campaign program that we use where we actually monitor results from those campaigns, and we're able to track trends. It also gives us the ability to target users and groups of users that are more susceptible to these campaigns, including new hires that come into the organization. We use an app on our Northwell app to communicate out. We run contests and campaigns. In fact, October was Cybersecurity Month, and we actually had a contest and gave away a pair of tickets to a Ranger game, which seemed to be an effective way to get people's attention.
Some sort of motivation.
Yeah, and get them engaged
Right.
and show them. So, we posters we use, we have a whole host of different methods that we use. And we usually identify or come up with a theme of the month and then target the various communications around that. Or if there's something that happened in the world, we use that as a theme to communicate out to people how to not only protect patient data, but also their personal data. So yes, we've had that position for a few years now, and it's really matured and grown over the years, and that is a key focus area for us because protecting patient data is our number one priority.
Right.
And we really rely on our workforce because I often ask the question when I go give talks at different presentations. I ask them, how many people do you think are on a security team? And you get answers, 5, 10, 20, and I'm like, no, there's
Every single one of you is needs to be on the security team.
67,000.
Yeah, that's amazing.
Yes.
So I know that the healthcare industry, and it's so important to have that awareness in every employee because the healthcare industry is the number one target for cybercrime. So with your role at Northwell and what you do at your organization, how does that come into your daily, work?
Yeah, so healthcare is the number one target for cybersecurity, and that's been published in many different journals. And the reason is because the value of patient data is so high.
That's why.
That's why it's a target. And typically on the dark web or the black market, a cyber criminal could get about $2 or $3 for a credit card number. can get about $50 or more per record for healthcare information. And there's reasons for that. Is that healthcare data is used for a lot of fraudulent use, including insurance claims, prescriptions, lab tests, surgeries. It can also be used to file fraudulent tax claims, because if you have that basic information, it can be used in many ways.
It opens up more doors.
It opens up more doors,
Yeah.
and
More than a credit card number does.
more than and credit card numbers. And I'll just share this quick story. Is years ago, I had gone to buy a television set because I had a big picture tube TV, and it went poof one day. The picture tube finally blew, so I was the last holdout. It was time to get a flat screen TV. So I went to Best Buy, and I had to buy not only the TV, but the receiver and the Blu-ray DVD. So it came to a pretty significant amount. The sales clerk rang up the sale, pressed the enter key. Next thing I know, I'm getting a call on my phone. This is the American Express fraud
Credit alert,
department.
sure.
I'm trying to determine if this is really you making this purchase at this location. So I went through this whole process to do that. About a month later, I went into a hospital. I had to have some surgery done. And had the surgery done, was in the hospital a couple of days, came back home. A month or two later, I get, the insurance statement that listed all of, and looking at this, and it was, several $100,000, and, between all the doctors and the anesthesiologists and the surgeons and the physical therapy and all of those different charges that you get, and you look at this, but it was several months later that I actually received this statement from the insurance company.
As opposed to immediately.
And opposed
in a
to
retail
immediately.
environment.
Right, exactly, in a retail environment. And so, when people go to get these procedures and surgeries, they're asking for your date of birth and all of that. But I think we really need to, as an industry, evolve more to biometric or some kind of technology where you can really validate that you are who you are, to make sure that that's really you getting the services that you're needed. There's been many cases where people have gotten insurance statements and said, wait a minute, I never went into the hospital and had my foot amputated. My foot's still here. Or I never had a child, and yet they receive bills for this. But it's not till months later, when those services have already been rendered and these claims have already been filed and paid. So there's a lot to do. That's why the data is so valuable, is because there's this pretty significant length in time between the time a service is provided and the time the person is notified.
That's very interesting. I want to talk a little bit about the cybersecurity workforce shortage. How do you go about finding the best professionals to work for you?
Yeah, it's difficult. I know when I talk to people, because I'm so impassioned about it, that I try to exude that passion for it. And I try to, when I talk to people, explain to them, this is your friends, your family. This is our job here is to protect the patients that we in the community that we served, and that's a really, I think, very important and social responsibility that we have. And so I think that people really do understand that and can and feel that same passion that I do when I'm trying to get them to work for us. But it is a difficult market. There's a tremendous shortage, and the shortage is projected to get even greater as time goes on. So we do leverage managed service providers. We hire companies that focus in cyber security. Those types of firms, might have a better chance at recruiting and retaining people there. It also it benefits us because it gives us coverage over 24/7, 365-day window.
Sure.
And they have a very they're focused on a very particular area. So we use that for off-hour support, holiday and weekend support, and even just staff aug if we need resources for whatever reason, if people are on vacation or such. So managed services, we do hire consultants. We're also leveraging an internship program. I'm developing that with a couple local colleges in the areas, and that's been successful so far. We've gotten some really good talent from there. And then also just internal, I know so-and-so, internal referrals or referrals from other people within Northwell. We're a huge organization.
Sure.
So there are people that might be ready or interested in getting into a career, so we actively recruit from that internal as well.
So I think it's interesting about the young people in colleges and getting some interns and things like that. Do you have any advice for someone looking to start a career in cybersecurity?
Yeah, there are so many different exciting opportunities in cybersecurity. There is not only the security technology area, which most people tend to, think of first when they think of cybersecurity career, but there's also other opportunities in risk management where you're really out there trying to understand the risks and the threats and how to protect, how to detect and respond to if something does get exploited, some type of vulnerability is exploited. So that's a whole area, risk management. There's the security training and awareness, as we spoke of, which is another really interesting field and very rewarding when you see that people are getting it. And when you get phone calls from people like, oh, I passed the phishing test that you did, or you know what, I didn't pass the phishing test, but I really learned something from that, and I told my daughter and my brother. These are all things that really happen, and people feel very engaged in that. And so engagement and employee awareness is very important. There's also opportunities in disaster recovery and business continuity, because part of what cybersecurity is about availability of systems. And there are incidents that you have to always be prepared for. Incident response is a key area that we need to be focused on and be prepared, because you're not going to be able to prevent everything. You have to be able to detect, and you have to be able to respond to in a timely manner. And there's also, vendor risk management is another area too, just because of all the partnerships that we have with outside entities. We have to make sure that they're following the same level of security and that we are, and educating them as well, and making sure that they adopt best practice.
I hear from women and younger women and girls who are in high school and college that they don't want to pursue a career in cybersecurity because they think they're going to be stuck behind a computer all day, or coding all day, or in a security operations center or something like that. It sounds like that's not the case.
Yeah.
Well, I mean, with the risk management and things of that nature. What would you say to girls who are listening? Because I do consider you a real role model for women in cybersecurity.
Yeah, well, yes, and it's not that. And honestly, that was my perception too. A bunch of geeky computer guys that sit behind screens. And probably one of the areas that you get exposed to most in this field is interacting with other people, and being able to build relationships and explain the importance of security and kind of promote that message. And I think that's very rewarding, and that can be done through the security awareness and training program that we have in that area, through risk management, explaining what the risks are, why it's so important. There's nothing more rewarding to me when I get a doctor calling me and he wants to bring in a certain medical device or some type of technology, and it's going to provide all this clinical value to the organization and to patients. And it's always a great discussion when I learn about that, and I'm also explaining to the doctor about the importance of cybersecurity, because in order for that device to work and be relied upon, and for the data and the data integrity from that device to be something you can rely on to render care, you have to have security. So it's always a really great conversation to have, and it's very rewarding in many ways to kind of
helping a lot
promote
of people.
Helping a lot of people. And
Absolutely.
So there's a lot of people interaction. There's a lot of self-fulfillment that you can get. And there's a lot that still needs to be done in this area. So we do need people to pursue this as a career.
Thank you so much, Kathy. This has been great.
Thank you.
speaking with you. And I really appreciate you coming down for our Ask the CISO series.
Thank you so much for having me.
Thanks for coming.